Welcome to the OHSU Effect Inside Health and Science. I'm Lacey Evans. Today on the show, we're going to learn about the Let's Get Healthy initiative. And at 8:50, we're going to hear how OHSU is taking into account the environment and the local economy when planning meals for patients and staff. But first, allergies. Spring is almost here, which means more pollen in the air, which is going to make a lot of people miserable. But there are also food allergies, even occupational allergies. With me now on the OHSU Effect is Dr. Anthony Montanaro, Chief of Allergy and Immunology at OHSU. Good morning.
Good morning.
So when does allergy season really kick in the Northwest?
Well, actually, it's interesting that even on these cold, rainy, gray days that we're experiencing right now, we still have tree pollen coming. So we can see tree pollen as early as February, but we start getting the tree pollen coming on with a vengeance, usually later in March and in April when the air temperature increases a little bit.
And how long does it usually last?
The tree pollen season is really our first significant pollen season, and that's pretty much, as I said, late March through May. And then about mid-May is where the classic hay fever sufferers really start getting affected. Probably, I tell people it's usually right around Rose Festival time, mid-May through the first week in July.
You mentioned tree pollen, but what are the most common allergies in the Northwest?
Well, the most common thing we see is grass allergy because it's a very potent, it's a combination of the fact that the allergen itself, grass pollen, is very potent, and secondly, our geographic and climatic conditions favor, the grass pollen counts being very high. In fact, in the Northwest, during some parts of the year, we have the highest counts that have ever been recorded on Earth, much less in the Northwest or United States.
Wow. So then how do we compare to other parts of the country in terms of seriousness, length of season, stuff like that?
Well, if you look at overall at allergies, because we're colder and we don't have as long of a pollen season as some of the areas like in the Southeast or the Southwest, but we have a much more intense season, particularly during that time that I mentioned. It's pretty much May and June phenomenon. People get really sick in May and June. They'll come in and tell you that they can't work, they can't study. For students, particularly down in Eugene and in Corvallis, where the grass or grass seed is growing, they get just profoundly affected. So it's a really significant problem. I think the people who don't suffer from allergies tend to trivialize it. They say, "Well, just get a handkerchief or a Kleenex and put up with it." But when you measure the impact of allergies on quality of life measures, which we do in a very objective way, allergies can have a more profound effect on individuals' quality of life than many other disease states.
So what are the signs that someone should see an allergist?
Well, we tell people that they should seek advice, certainly from their primary care doctor, whenever over-the-counter medications aren't effective. And we do have some effective over-the-counter medications in the form of just antihistamines that used to be prescription and are now available over the counter, and they can be very effective for some people. Zyrtec, which not that long ago, a couple of years ago, was $3.50 a tablet. You can now get generically for under 5 cents a tablet. So that's a very cost-effective way of trying to control your allergies as a first step. If that doesn't work, then they should seek care from their physician. And if the kind of routine measures that are used aren't helpful, then being referred to a specialist is really helpful. I think that the other area that the specialist can be helpful in is trying to identify triggers that you can potentially avoid. We've talked about the seasonal allergies being, trees and grasses. But some people are really affected by indoor allergens, and those can be year-round, things like dust mite and mold and animal danders. And so many times the patients are unable to identify what's really affecting them, and so they require testing for that for them to try to avoid those.
Yeah, I do want to talk about the other different kinds of allergies and the testing, but first I wanted to ask, is there a way to tell if you are suffering from allergies or if it's just a cold? Some people are always wondering that.
Yeah, many patients. In fact, it may be the most common presentation, and patients just come in and say, "I'm stuffed up. I feel like I have a cold all the time." Well, first of all, a cold usually doesn't go much longer than 7 or 10 days. So the fact that it's persistent may suggest allergy. The fact that you get itch is highly suggestive of allergy. If you get itchy eyes and itchy nose and itchy ears or itchiness in the back of your throat, that's more characteristic of allergies versus just having a viral infection or whether you maybe even have a sinus infection that can cause those allergic-like symptoms. So, those are things to look for, but in the end, they can mimic each other. So it's sometimes very, very hard to tell.
When do allergies normally develop for a person? Is it when we're younger or when we're older?
Yeah, that's a very good question. The allergies normally develop before you reach the age of 30. So 90% of the time, you will have manifest some allergy by the time you're 30 years old. So most of the time, it comes on in early life, and it tends to come on, in that kind of 6 to 11-year-old is the most common presentation. So the school-age children, when they first get to school. So it's not very young or very old. It tends to be, kind of early childhood, and then it certainly can persist throughout life. So they don't go away, unfortunately, as you get older. I think that's a misconception that older individuals don't suffer from allergies, because we certainly see, 70, 80-year-old individuals having bad allergies.
Yeah, that was my next question, actually, if they go away. What about food allergies, though? Can that go away as a person gets older?
Yeah, absolutely. Food allergies is one thing that you can kind of, quote, outgrow because your immune system kind of develops tolerance. And food allergy is more a manifestation of early childhood. And for instance, milk allergy, 50% of the time, the child will outgrow their milk allergy by the age 5 if they present in infancy. So that severe food allergy can prevent in infancy and get much better as you get older. So with milk and egg and sometimes wheat, the child can so-called outgrow these allergies. With things like peanut, that tends to be persistent for most kids. We estimate anywhere from 10 to 15% of children who have peanut allergies will outgrow them, but over 50% of children with milk allergies will so-called outgrow them.
How are allergies diagnosed? Is that an easy process?
Well, I think as you alluded to earlier, it's sometimes difficult for the patient to distinguish allergy from infection, and it's sometimes hard for doctors to discriminate it based just even on talking to the patient and examining the patient. So testing is many times necessary to help the patient and help the families determine what they're allergic to.
And you mentioned those over-the-counter antihistamines, but what are the most common treatments for allergies?
So the most common allergic disease is what we call allergic rhinitis, or sometimes called hay fever. It's probably a terrible name because that doesn't come from hay and it doesn't cause a fever, so it's not the greatest name. But nonetheless, it's actually the most common condition in childhood. So it's really common. It affects about 17% of the adult population, and over 20% of children suffer from it. So it's really common, and the most common complaint is congestion, and the most effective treatment for congestion are the use of intranasal steroids. And a lot of people say, I really don't want to use steroids, but these are very safe. They're applied topically, and now we have even a generic form that can be much more affordable.
So what other advice do you have for patients who suffer through allergy season each year? Anything else that can give them relief?
Well, I think my advice to anybody who suffers is there's no need to suffer. We have very effective tools in trying to control allergies, and they start with over-the-counter 4-cent antihistamines, and then they can progress all the way up to allergy shots, which allergy shots can be a way of actually changing the course of their problem. So, we have a lot of different tools, different types of medications for patients who suffer from eye manifestations of environmental allergies. We have good eye drops that can be helpful.
Well, I want to talk more about food and pet allergies. So can you stay with us through the commercial break and into the other segment?
Sure.
Great. Speaking with Dr. Anthony Montanaro, the Chief of Allergy and Immunology at OHSU. More with him coming up in 5 minutes on the OHSU Effect.